paying for health care, insurance for those covered through the Affordable Care Act kicks in on the first day of 2014. There's a big effort underway to make sure that people can find a plan that's right for them. But as our fact finder Matt Markham discovered, it's really going to be a tall order for the health care providers as well. Matt?
That's right, Liz. The focus now for hospitals is keeping you happy and healthy. They will lose money if you're sick and come back too quickly under the Affordable Care Act. The hospitals themselves are working on a few preventative procedures of their own, and it all depends on how you use the system.
I'd say it's a gradual evolution, but I'm afraid it'll be kind of a rapid evolution.
The biggest change to healthcare in years rolling up to hospitals like Ellis in just a few months. It's difficult for the hospital to take a pulse on how many people could pay a visit since enrollment to healthcare exchanges begins on October 1st and insurance kicks in January 1st. That gives medical centers 4 months to figure out how to change their models if they actually have to.
There is going to be ongoing pressure on the healthcare industry to continue to provide care to people, but do it in the least costly venues.
That's why you're already seeing urgent care centers like this one in Clifton Park pop up. Other questions revolve around penalties. The hospital will be penalized for readmitting Medicare patients too soon after discharge. The hospital must also see how many patients choose to take personal penalties for opting out of health insurance.
They can use that year to measure the effectiveness of the exchanges, and they may come to the conclusion that this is a reasonable way to get insurance coverage.
The kind of care you receive at the hospital shouldn't change, but Connolly suspects some community screenings and education may suffer as insurance kicks in 2014. What is the hospital doing between now and then, and how might things change after that?
There really is nothing we can do right now until we see how many people who were insured and we got paid, you know, $A, now go through the exchanges and we get paid $B.
The revenue stream is important for the hospital and for everybody else. It all comes back to money, and Connolly says one thing the Affordable Care Act incidentally didn't do is really addressed cost very well. So that could change our relationship with the hospital, and I'll explain what that means for all of us coming up at 6 o'clock, Liz.